guys, I'm Kieran, and today I'm going to be presenting to you my position paper on HPV, the human papillomavirus. The debate here is whether it should be mandatory for 11 to 12-year-old girls, and I'll talk a bit later about why it's specifically aimed towards girls. So I decided to do this project because when I was in middle school getting my required vaccines, the doctor would always ask my mom, do you want her to get the HPV shot? And she always very adamantly said no. And I always wondered why that was. So before doing this, I decided to ask her, and she said she thought there were too many instances of death as a result of the vaccine, and that not enough research had been done on it to support its long-term safety. So I decided to take a look into it and see what it was all about. So first, we got to talk about what is HPV. So it's the most common viral STI in the US. There's bacterial and viral STIs, and since this one is viral, that means the virus gets into the body cells, takes over its DNA and replicates its own DNA, and then sends out those viral cells into the body to invade. So since it's an STI, it's transmitted through genital skin-to-skin contact, and it can cause genital warts, which that infection, it's chronic, it never goes away. The warts itself may go away, but then those cells could still lay dormant in there, so they can have reoccurring episodes of genital warts, so it's not curable. And it can also lead to 6 different types of cancers. The most concerning one is cervical cancer for women because it's the 2nd most common cancer and 5th leading cause of death for women worldwide. So that's definitely nothing to joke about. It's very serious. And it can also lead to anal, vulvar, penile, vaginal, and oropharyngeal cancer, which is back of the throat, tongue, and tonsils. So very serious. And as the instances of HPV increase, so do those instances of HPV-related cancer. So there's currently 2 HPV vaccines available. One's for Gardasil, and that's been available since 2006. That's the first one that came out, and it protects against type 6, 11, 16, and 18. And then there's also Cervarix, which protects against type 16 and 18. And since Gardasil protects against more genotypes, that one is more commonly recommended by doctors. And according to the CDC, approximately 14 million Americans become infected with HPV each year, and as it becomes more common, those numbers rise. Okay, so what's the big deal about HPV? So like I just mentioned, it's becoming increasingly more common, especially among teenagers, because of course they think they're like invincible, or they can't get hurt, they can't get sick, they're not going to get an STI, so they're more likely to engage in riskier sexual behaviors like condomless sex and sex with multiple partners. So there's debate over whether to make the vaccine specifically for 11 to 12-year-old girls because of course they're the only ones with cervixes, so they're prone to cervical cancer if they get HPV, so that's very serious. Supporters for the mandate argue that it's safe and preventative, provides long-term protection, and is cost-effective, while as the opposition argues that there's way too many adverse side effects. It leads to riskier sexual behaviors, and it takes away parental rights and autonomy. And after doing research, I believe that it should be made mandatory because the pros simply outweigh the cons of it. So that's my take. I believe that it should be mandatory. So first we're going to talk about what supporters argue for a mandate. So they think first and foremost it's safe and preventative. Studies have shown that genital warts and HPV-related cancers have decreased 86% in teenage girls since the introduction of the vaccine in 2006. And the CDC estimated that out of 36,000 cases of cancer caused by HPV, the vaccine can prevent about 32,000 of those infections. So this is an 89% prevention rate, which in my opinion is very good. And another study showed a 90% efficacy rate against type 16 and 18 if you do get the 3 recommended doses of the vaccine. So 90% efficacy is pretty high rate. But it should be noted that the vaccine should be given before the age of 15 in order to provide the most protection. You can get it as early as age 9, but the recommended age is about 11 or 12 because at this age most adolescents aren't sexually active. So if you get it at that age, it'll protect adolescents who choose to have sex at an earlier age, like 14 or 15, or for those who choose to, do it later, like 19, 20. So the earlier you get it, the better, because HPV vaccine is not a vaccine that's meant to treat the infection, it's meant to prevent. So if you have already come into contact with HPV, then it's not likely that it's going to help you. So the earlier you get it, the better. Secondly, it provides long-term protection. There's no evidence of decline in protection over time. So that means that the efficacy rate is going to remain pretty high and stable. So 1 month after the vaccine, it's not like if you get the vaccine 1 month, it's going to be 90%, and then 2 years after the vaccine, the efficacy rate is going to drop down to 65%. It's going to stay at that 90% throughout the years. In 2 studies I read about demonstrated protection for up to 5 years, but these studies were only carried out for 5 years, so it very well could provide protection past that 5-year time period. And one study did like a modeling study that suggested that HPV vaccine could provide protection for up to 12 years. So you may have to get a booster shot after that, but I think 12 years is a pretty good time period. One study did suggest that there might be some cross protection against genotypes 45 and 31. With the Gardasil vaccine, it protects against types 6, 11, 16, and 18, but there's some suggestion that it could protect against these types as well, but of course more research has to be done to definitively say that it can protect against these as well. And lastly, it's actually cost effective in the long run. Many of those who argue against the mandate say that it's too costly, but if you look at it, it's actually cost effective. So 1 dose is $190 to $230, and then the recommended 3 doses is between $380 and $690. And if you add that to the cost of a routine cervical screening, which is about $103, that comes to $800. So the preventative measures you would take against HPV would come around to about $800. And that's much, much less than if you were to have to pay for treatment of an HPV-related cancer, which can cost between $19,800 for penile cancer to $43,200 for the cancer of the throat and tonsils. So it's much, much less, more cost effective in the long run. So now we're going to talk about what opposition has to say and their arguments against the mandate. So I think the most argued one is that it's too many adverse side effects. The most commonly reported are pain, redness, and swelling at the injection site. I feel like that's relatively common for a vaccine, for all vaccines, simply because you are being stuck with a needle, so it's going to leave maybe some bruising or pain there. But there's also fever, dizziness, fainting, nausea, headache, fatigue, and muscle and joint pain. I feel like these are relatively harmless. Like, don't get me wrong, they can progress into something much worse, but I don't feel like it's going to cause a lot of damage for the person if they were to have this reaction. More serious side effects have been reported. In Japan in 2013, the government recommended that girls 11 to 13 get the vaccine, but 2 months later they actually suspended it because there were too many reports of adverse side effects. Some of those were ovarian dysfunction, severe autoimmune disorder, and death. But after researchers looked into it, they found that the effects could not be directly attributed to the vaccine. Rather, the girls had underlying problems that most likely caused those side effects. So. And there's also nothing in the vaccine to suggest future safety problems. One study compared it to HPV vaccine, which is hepatitis B, which is another STI, and they said that there was nothing in either Cervarix or Gardasil to suggest that its long-term safety differed from the HPV vaccine, which has been a mandatory vaccine for many, many years. So and that, of course, since it's been around longer, it's been the safety of it has been documented for long term. But of course, more research has to be done on it. And the second one, risky sexual behaviors, that one was very interesting to me because many parents fear that talk about HPV and STIs and, how you get an STI through sex is going to lead to riskier sexual behaviors. But one study said that in order for that to be true, you have to have an underlying assumption that fear of HPV is what motivates these kids to not partake in riskier sexual behaviors at an earlier age. However, most women don't have much knowledge about HPV, so the fear of it is not likely to increase these behaviors simply because they don't know about it, so there's nothing to fear. And also, school-based sexual education and condom distribution programs don't increase sexual behaviors in high school students. There's been many studies done on that. And so talk about sex, HPV, STIs is not likely to increase sexual behaviors simply by talk of sex itself. And lastly, many parents think that their parental rights and autonomy over being able to decide what is best for their child is going to be taken away if the vaccine were to be mandated. But in this case, you have to look at whether the benefits of the vaccine are enough to justify the government being able to override that parental authority. And Haber and colleagues actually provided a justification, and I wanted to read it to you guys because I thought it was a solid justification. So they say, those that argue in favor of school entry mandates point out that many childhood vaccines have been required for school entry for quite a few years, that such requirements have been successful in reducing the incidence of infectious diseases and establishing herd immunity, that HPV vaccine has the potential to protect against approximately 70% of cervical cancers, that mandated vaccination helps significantly to overcome healthcare disparities, and that the state traditionally has taken a particular interest in protecting children's health. So they're saying here that other vaccines that have been required for school entry, they've been around for many, many years. They have shown to be safe, have decreased instances of the disease, and provide herd immunity. So, this is that's the same thing, so why not make this mandatory as well if these other mandatory vaccines show the same, amount of reduction in instances and protection. And of course, there are religious and philosophical exemptions for vaccine requirements. So if a family is part of a religion that doesn't allow it or is against it, there are those options to opt out. So it's not like if the vaccine were to be made mandatory, there's no way of getting out of it. There are some exemptions for those who, are able to take advantage of it. Okay, so now that we talked about the problem, how are we going to solve it? In my opinion, if the vaccine is going to be made mandatory, there's still going to be people who oppose it and are going to want to repeal it. So I don't really think a true solution is ever going to be made. I think there just needs to be kind of a meet in the middle or like some sort of compromise. So I think first and foremost, there should be better attempts at educating individuals and the whole population about HPV and its consequences, as well as the vaccine. If you're going to get vaccinated, you want to know, okay, what's the pros, what's the cons of it? And like I mentioned earlier, not many people know about HPV. I know I was not taught a whole bunch about it in middle school and high school. I hardly knew anything about it, and I just knew it was simply an STI before actually doing this project. So, I'm 20 years old and I'm just now finding out about what HPV really is and what the vaccine really is. So, and it's also important to, again, educate those individuals that it is a preventative vaccine rather than a vaccine that's meant to treat the disease. I think that's very important to inform people about as well. So secondly, I think it should be made mandatory for both boys and girls. If it's just mandatory for girls, parents of daughters might think they're being singled out or something like that, but also it's cost effective if boys were to get vaccinated as well, because that would mean they would be protected against HPV, so they're not likely to pass it on to a woman through sexual intercourse. So it's going to not only provide protection for the male, but the female as well. So, and I mean, overall, if both sexes were to be vaccinated, it just means more protection, more blanket of protection. And of course, I think it's still important to offer those religious and philosophical exemptions because you don't want to discriminate against, you know, a religion, so it is important to be mindful of religions and philosophies that don't believe in the vaccine or, you know, something similar to that. So those are important as well. Well, that's about it for my position paper on HPV, and I hope you all enjoyed it.